Again, I want to welcome everybody to today's webinar. This is Tamara Hyatt with PracticeAdmin. Welcome to today's summer webinar series, our July webinar. Today we're going to be discussing the keys to success for outsourcing your pre-certs. And we'll be having Grant Schuchman with Precert Pro joining us today as our industry expert. Grant, are you there?
Good afternoon, Tamara. How are you?
I'm doing great, Grant. I'm glad you could join us today.
Thank you for the invitation.
Very quickly, our agenda today is it's all about pre-certs, pre-authorizations, pre-certs. Grant, very quickly, I know I get this question a lot. What is the difference, or is there a difference between pre-certification, pre-authorization? Now, I know many of us know that, but I get that asked a lot. How would you answer that?
There are some very minor technical differences, but to be honest with you, Precert Pro, we use the term universally. So
Yeah.
I did want to be clear about that up throughout our presentation.
Great.
That when we say pre-certification or pre-cert, we are in fact talking about prior authorization as well.
Great. I've heard it used interchangeably. I think there are some minor differences. I suspect that I think prior authorization refers more to hospital admissions, and pre-cert generally refers more to services and treatment and medication, but they both have the same process. Okay, so briefly today, we're going to talk about what are some different options for managing your pre-certs. What does managing pre-certs cost your business? Who is Precert Pro and how does it work? And why would you want to use Precert Pro? And then we'll be opening up to questions. We have joining us today Grant Schuchman, who is the founder and director of Precert Pro. He's a healthcare consultant managing business development for Neltner Billing and Consulting. And he also consults with medical practices on strategic sourcing and helping them to make financially sound business decisions. Again, Grant, thank you for joining us. I appreciate your expertise in this area. So first of all, we all have had experience, I'm sure, with managing pre-certs and what a challenge that can be. Can you tell us a little bit more about what these challenges are? And you can jump off into that for me.
Absolutely. No, again, I did want to say thank you to Tamara and to PracticeAdmin for the invitation. We've been working with PracticeAdmin for quite a while, and so we've been looking forward to the opportunity to share about Precert Pro. I do want to mention up front that even though pre-certifications are technically a part of the patient registration process, they really are still a part of the revenue cycle. So we just mentioned that we use the term pretty universally, but since they are a part of the revenue cycle, like any other function, charge entry, coding, payment posting, especially AR follow-up and denials, one small error can be very costly. And more importantly, an unorganized system for pre-certs can be very costly.
That's a good point.
So today, we're really going to show you guys how and why those costs come into play. So why would you consider your options with pre-certs? Well, number one, pretty much the only reason, it can be a headache. If it is a headache for you, then you really should give it to a specialist. Pre-cert and prior auth is enough of a headache that, to be honest, most billing companies pretty much stay away from them and leave the responsibility to individual practices. So by the end of our discussion today, I want to show you how you may actually be leaving money on the table, and if you're a billing company, possibly leaving billing or leaving business on the table. But in the end, again, if it's a headache, it's always best to let the expert deal with problems while you're thriving in your own wheelhouse.
Now, right, of course, there's also the cost factor.
Yeah, absolutely, and that's outsourcing pre-certs is an efficient way to handle resources and effectively managing the costs. And we're going to show you how some practices are actually paying more than $60 per pre-certifications. And I did want to say, Tamara, another big reason to consider your options when it comes to pre-certs is the same subject that everybody's talking about already, ICD-10.
Yes.
It will not be until after the go live in October that we truly know how many more pre-certs will be required. So I want to throw it out there. You know, are you prepared to scale an unknown portion of your business? If you're a billing company, are you prepared to provide a solution for your clients if they come asking for help? So Tamara, we're going to talk about how to provide a plan for that.
Excellent point. Okay, and then again, getting back to the cost, what does managing pre-certs cost your business? And I saw this grant on your website and thought it made some great points, so I've just summarized it here, and I was going to let you sort of walk us through these points.
Absolutely. Now, if I were to ask a volunteer on the call to share with us their internal cost per pre-cert, we saw on the last slide that it would likely be between $25 and $58. Now, I'm guessing if you're listening, you're wondering where your organization would fall. You're probably hoping that it's toward the cheaper side, right? Well, the truth is if I were to call someone's name specifically, there's a good chance they wouldn't know the actual cost, so we probably won't call anybody by name. But we're going to spend, I did want to say, Tamara, that we're going to spend a few more minutes on this specific slide because the information really is a key to managing pre-certs. So I do want to point out that Tamara was kind enough to reference the article at the bottom of this slide. So if you want more information than we're capable of covering, don't hesitate to go to our site to look at this in more detail. So Precert Pro has isolated 5 specific metrics that'll give us a quick snapshot of cost of pre-cert. Number 1 is obviously going to be volume. If you're going to know the cost, you have to know how many. Honestly, low volume, if you're processing 10 pre-certs or less per month, it's probably a good idea that you should keep processing those in-house. You're already familiar with your payers, and it doesn't make sense to transition into a process. But where volume is important is that some of us, again, don't know. One of my current surgery centers that's a client actually did admit to me that he had no idea how many pre-certs they were processing across 15 locations. So yikes, we got his attention when we asked him that question.
Yeah.
Now, how long it takes to process a pre-cert is a little tricky, and here's why. And I want to take a minute to talk to billing or office managers. Have you ever had to get on the phone to check the status of a pre-cert? Have you ever had to fax another medical record on a specific authorization? Likelihood is that if you did, you probably weren't tracking your time. The biggest one, have you fielded an escalation to get a retro authorization because the service was urgently or medically necessary for the patient? A lot of times this happens with no pre-cert. The biggest time trap for pre-certifications and consequently the biggest expense is working for pre-certs where the service or procedure has already been delivered or performed. This is also going to distort your hourly wage, especially if you've got clinical or administrative personnel getting involved in an escalation. Does that make sense?
Yes, and I'd have to agree. I've had the opportunity to work closely with some physician practices behind the scenes a little bit, and unfortunately, this process falls to their admins or people who have other duties, and it takes a lot of their time up, and I don't think they really track and realize how much time it's taking.
That's right. Well, once you know how much time and how many pre-certs, you have to look at the wage or what is it costing. And again, that's why it's expensive to have administrators or medical personnel. But wage also gets distorted because of overhead. So when we're looking at this metric, base wage plus 30% is generally an acceptable shortcut to understand your cost of staffing. All of a sudden, your $12 an hour person, if you've got a pre-cert department, that employee just turned into a $16 an hour cost when you're actually trying to calculate the cost of pre-certs. So once you know this, we're just shifting gears a little bit, the 4th metric is an interesting one. Why is it important to understand the average reimbursement for the items you're pre-certing? Well, it's because of the cost of making a mistake or the cost of errors. When you're factoring this, you have to take a look at what happens because mistakes will. Let's talk about a practice like oncology. It has a larger cost. An example would be on an average of $5,000 for a procedure or drug. Some doses of chemotherapy may be costing $20,000 to $30,000 per dose. That's very large. So my question is, do you think the staff is going to invest a few extra hours to ensure that they get the pre-cert? Well, you bet, because there's so much risk involved. To scale that back down to something that's a little more average, let's look at a surgery center once again. They'll openly admit that they perform surgeries with no pre-cert, but you got to ask why. Why is that happening? In a small practice, they're going to take more efforts to ensure that that type of risk is mitigated, but with something like a surgery center, it's a more complex institution compared to a solo practice. It may not be clear in the organization who had the responsibility or to track the pre-cert if it was obtained. Even the surgeon may not be aware to check to see if a pre-cert was necessary because he doesn't know the payer requirements. So again, the idea is once you have an idea of how much money is on the line from reimbursement, that moves to the final metric, which is how many errors are occurring.
Right.
So this metric affects the cost more than any other metric. When you're calculating your cost, this is the biggest one. Precert Pro actually recommends you account for at least one error per month. So let's say that you've got a procedure that's, or on average, you're pre-certing things that reimburse $1,000. If you're processing 100 pre-certs a month, this error is increasing your cost by $10 per pre-cert. Does that make sense?
Yeah, wow. Now, frankly, that's an area that I had never considered. I've seen other sort of similar questions like this, looking at a pre-cert process, but this is one that I think is often overlooked.
And if your error rate is low, that's great. There are ways to adjust this calculation, but typically what a low error rate means is that on the flip side, you're spending more time. And so again, if you're investing additional time to avoid those errors, it's still affecting the equation. Again, it's about how much. So these 5 metrics, again, are a quick overview. If you do want more details, please reference the article. But I think we should probably take a look at an example.
And this is a question from myself, Grant. Don't some practice management solutions also help to manage or follow the pre-authorization forms? Often they're attached to the record.
Are you referring to payer-specific forms?
Yes. Mm-hmm.
No, absolutely. Each payer has a different channel that they require for processing, and it's going to be through the phone, fax, or web.
Right.
And a lot of times they do require a specific form being filled out to be faxed. We were just speaking with someone this morning who was asking this very question, and the answer is yes. When Precert Pro works with a client, we make sure that first off we have the form that the payer is looking
Mm-hmm.
for, and if you already have a copy of it, we obtain a copy of that when we start our agreement. And so we're simply operating off the same form. We fill out the information and send it as opposed to your staff.
Great. And I thought this was a great little tool that you guys offer. Again, I think you have it on your blog, on your website at precertpro.com. And it's a very quick and easy way to sort of calculate the cost to your business. Can you walk us through this form?
Absolutely. At first glance, the fields that are highlighted in yellow are the 5 metrics we just discussed. The text that shows up in red is the cost per pre-cert as well as the monthly cost. We did make a couple of assumptions in this calculation. The first one, which is your first metric, we've assumed of the 250 pre-certs that you're processing in 1 month that there'll be a single error, and that's the last metric. Again, so that's just an assumption. What we haven't included in this example is the cost of the 30% overhead. So again, we're just trying to keep this example simple. The results, well, they really speak for themselves. When we said it was a range of $25 to $58 per pre-cert, this example falls right about in the middle. We chose this example for our blog because it's relevant to most practices. You may just need to simply adjust some of the numbers. Now, you're probably wondering when you're looking at this, what would the cost look like for our practice? Or if you're a billing company, you'd be wondering, what does it look like for one of our clients? The good news, as Tamara mentioned, head to our blog. There's an article titled, "What Does Your Internal Pre-Certification Service Actually Cost?" And you can download this calculator. You'll actually have the ability to type in the specific numbers. So I'll tell you, one of the cool things about this calculator is that it shows you, when you start playing around with it, which of the metrics you can easily change for your organization and how much it affects the end result.
Very simple, but very effective. That's nicely done.
That's right. Now, I do want to say on a side note, while we're still looking at this slide, Precert Pro is going to show you today how to get the number in red, $43.70, down to less than $10.
Wow.
This is a monthly savings in this example of about $8,400, and this cut costs by 77%.
Great. Okay, moving on. So we've talked a little bit about pre-certs and what a headache they can be. And Grant, I know your company, that's your focus, is helping folks out there manage their pre-certs. Can you tell us a little bit more about Precert Pro and who you are and what you can do?
And the staff at Precert Pro have been processing precerts and authorizations for about 30 years now. And we took our internal department from our sister billing company and actually spun it off as a standalone service. For you billing companies, this gives us a perspective that you're going to want to hear about in more detail. We'll talk about this just before the end of the webinar. But in any situation, it's important to have someone working on your precerts that understands the dynamic of the entire revenue cycle. I describe it like this. Precert Pro really is like using your electric company. When you need us, you flip the switch on the wall. We make sure the lights come on. If you don't need us, you don't use us, and you don't pay. We are a little different, Tamara, because we do give discounts on volume. Price breaks tend to come around 500 to 1,000 precerts per month. For a small surcharge, we'll actually process a stat order and get those results back in within 2 to 24 hours. But at the end of the month, what we do is we just tally up your usage and we send an invoice. The price at this point, everybody's looking for that, is going to be, we charge $7 for a pre-certification.
Thank you. Let's move on to your specialty, is dealing with specialties.
Right. Since Precert Pro was devised with actually oncology customers where precerts are vitally important, we quickly offered it to our other specialties, and these included pain management, anesthesia, cardiology, and physical therapy. Now, we've developed into other specialties just on precerts, and those include all types of surgery, OBGYN, and various others like radiology and sleep clinics. The list is a little larger, but we also do workers' comp and DME for pre-certification and authorization.
All right, and we do know that each of these areas, they tend to have some unique requirements, and specialties can be a little more complex than some typical physician practice.
That's right, and we adapt. Our view is that with an understanding the complexities, it's not difficult for our experience and our staff to understand the nuances of other specialties.
All right, so can you briefly run through how does Precert Pro work? Let's say I want to sign up with your service today. What happens and how does where does it start?
Sure. Well, how it works is you submit your request to Precert Pro. It can be done in one of two ways. The most effective way is to allow Precert Pro to have remote access to either the medical EMR, the billing system, or the scheduler. Or if some practices, it just doesn't work for their operations, they just submit the procedures to Precert Pro along with any medical records. Some of the billing companies we work for, their clients were faxing them orders and medical records. They just simply diverted that to Precert Pro.
Right.
The next step, we contact the payer through their desired channel. Again, it's going to be through web, fax, or via the phone. Precert Pro will stay in contact with the payer to get the results, including gathering additional patient information or medical records along the way.
That takes care of a huge headache right there.
I was just on the phone with a nurse, and she was telling me, Grant, I have to collect the H&P for the precerts that I'm responsible for. And I just said, I explained to her, I said, wow, with your education and experience, that's the last thing we want. Right. We've got to free you up. So, yeah, and I explained to her that once we get the results, again, we're going to deliver it back to the practice.
Great. Okay, and again, let's go over some of the more specifics on why would somebody look at Precert Pro and what you have to offer.
Yeah, Precert Pro can adapt. Our setup will be based on your current operations and what type of access you'd be willing to extend to our team. Precert Pro has the ability to drive down the cost the lowest when we do have web or cloud-based access because this gives us the ability to pull medical records. We can check the schedule. We can even do your eligibility. And then we'll place all of that is the ability to receive the order. Now, with system access, we simply put the authorization number back onto the claim or report to the office that we are that it's been obtained so that they can do the schedule. Now, we're going to set up communication channels with the office. Communication is key. This is for several reasons. If the office needs to contact the patient directly for additional information, we need to tell them. if we need to set up a peer-to-peer review with the payer's physician, or in the event of a predetermination. For you specialties that are outside of surgery, just to explain predetermination, it's a similar level like a pre-certification, but Precert Pro actually obtains the predetermination number instead. It's also something that's part of our service at no additional charge.
Okay. Why would a potential physician's practice or specialty hesitate in using this service? What would sort of hold them back? The fact that they might lose control of some of their data, or what in your experience are some of the biggest questions you get?
In the end, a lot of it has to do with comfort. But since billing companies tend to avoid processing pre-certs, and there aren't many individual companies like us who just process a pre-cert, you have to, there's HIPAA compliance involved. You would sign a BAA. Sometimes it involves medical records. That's a big one. They want to keep those in-house. But once you understand that we have the experience, and this was born out of a company who is grounded in taking care of all of those requirements, honestly, that tends to absolve. The best way that I explain it when there's issues is, hey, if you've got James at the front desk and he's processing these, you're going to equip us the exact same way that you're equipping James. You just have to, we'll work with you to get the information. That tends to relieve a lot of the fear.
Right. Now, I know, Grant, I know you specifically wanted to talk directly to our medical billing companies and then also discuss a special offer you're making.
That's right. Before we do go into the offer, again, I do want to take a moment to pause and talk directly to our billing companies. First, even though pre-certs are relatively simple in nature, as I just mentioned, they do carry a little risk. You have to, again, medical records, payer communication, tracking the workflow. The biggest risk is actually financial. What happens to one of your clients if they lose a full reimbursement on a drug or a procedure because you didn't get the pre-cert? For these reasons and a few others, many billing companies, again, avoid processing or offering the service, and it pushes the responsibility back to the clinic. So some billing companies will offer to process pre-certs because they just have a solid relationship. But again, we would say, let's consider your costs, and we've already discussed that. Well, this is where you can leverage Precert Pro. I want to ask a couple of questions here to our billing companies. What kind of prospect would turn you down for billing services who would consider an offer just to process pre-certs? Think about that for just a moment. If you were able to get a contract to process pre-certifications and earn money without doing the work, would you do it? So adding a service to your service line. And then lastly, would you be willing to sell a single service solely to put yourself in a working relationship with decision makers for other services that are on your line? This positions yourself to solve other problems at a later time. Would you consider using that to get in the door? Precert Pro gives you a billing company the ability to solve problems that we've been previously unable to solve. Precert Pro opens relationship doors that have previously been closed or even locked. Precert Pro gives your billing business an edge. It really does. So it's important to understand that Precert Pro works on volume. The pricing structure was built in a manner that if we get volume, we're actually willing to share some of the fee because then, of course, we're not having to do any marketing, selling, or networking. So I do want to say to our billing companies, if you're interested in working with Precert Pro, possibly adding a revenue stream, giving yourself a different edge to get through some doors, I want you to contact PracticeAdmin and let them know that you're interested in an affiliate relationship. And Tamara, how should they do that?
Right. Thank you, Grant. You're welcome to send an email directly to marketing@practiceadmin.com or to sales@practiceadmin.com. Or you can also go to our website and find out how to contact us there as well.
This is a very powerful service to use as a business tool. I can't emphasize that enough. So again, what was the email ID again?
Marketing@practiceadmin.com or sales@practiceadmin.com.
Okay, great.
And we'll be
Now,
looking for that, and we'll follow up.
yeah, we'll be in touch for sure. So you'll see here, again, we mentioned our price earlier at $7 a pre-cert. I did want to take a moment to talk about the trial offer. For our attendees who are here today, we're willing to process pre-certs free for 1 week for a single physician, and this is no commitment to volume or time. It's a great way to not only experience the service, but to show results on how you can practically save money for your organization and free up time for other personnel. I do want to emphasize, though, that in order to take advantage of our trial, you must send an email to me by this Friday, and the email address is grant@precertpro.com. I know that we'll be rebroadcasting or at least make a copy of this webinar available. And so in the next several days, you'll have the ability to take advantage of this. Now, if you're emailing me, it's not saying, I'm going to do a trial. All it's saying is, I want to put my foot in the door to be considered for the trial. And then if it takes you, 30 days, maybe 60 days, it comes up in a staff meeting, hey, I emailed Precert Pro about a trial offer, why don't we take a look? If you have emailed me expressing interest before this Friday, we'll be willing to extend this trial offer.
Great. Thank you for those details, Grant. Oh, we already did that, didn't we? I'm going backwards. Sorry. All right. We're now going to open this up to questions from our audience for Grant or myself. You can submit your questions, and I will read them out, and we'll answer those questions. Again, I want to remind you, Grant's email is up here and his phone number, or you can visit their website. And also you can send questions to marketing@practiceadmin.com and contact us at this number for a demo for PracticeAdmin. I also want to remind you that we do have monthly webinars. The next month in August, we'll be discussing our PracticeAdmin partner with Dell coding services in preparation for ICD-10. Our CEO, Eric Christ, will be speaking to us about that topic. You can register now for that. And also, we'll be looking for another webinar topic in September. All right, let's see if we have some questions to answer. I did have a question earlier about if you can receive CEU credits for this webinar. Unfortunately, we have not set that up yet, but I'm going to look at that for some of our future topics. All right, Grant, you ready? I think I've got a few questions for you.
Absolutely.
All right. Some questions about the trial. How does it work, and how long do I use this service?
Sure. The trial, again, is designed so that you can experience the service. I know that some folks maybe here on the webinar have a supervisor or a boss. You want to take the idea back. This is a no-risk way to really gain value. We believe enough in our delivery that once you see it and the idea clicks, that an organization will latch onto it. So you just simply, you would contact me at grant@precertpro.com. We would then turn around and give you an intake form where we need to collect some data about your providers. We have to have NPIs, facility locations, things like this. We would sign a business associate agreement so that we can handle your protected health information. And then we would work on how does Precert Pro want to receive the data. If you want to fax it to us, if you want to grant us access to your system. And then once we have all that in place, we will take one of your physicians and process free for a week.
Okay.
This will give you the ability to get those results, and I can guarantee by the end of the week you're going to be able to make a solid decision on one: do you like us?
Right.
Do you like working with Precert Pro?
That's a great way to get your feet wet and see what it's like.
Absolutely, but most importantly, was it effective?
Right.
You'll be able, if you're not having to hand those papers to somebody else, or if you're letting us look up the medical records instead, it's amazing literally how it feels like you flip the switch and the light goes on.
Right. Okay, I've got another question here for you, Grant. Do you do pre-certs, predeterminations for plastic surgery?
Absolutely.
Great.
Actually, just on a quick note, we were recently processing for oculofacial plastic surgery, which requires a high-resolution image, and so we had to work out some custom details in order to receive those images to submit. But yes, we do have experience working with plastic surgery.
Great. And then let's see, here's another one. Does Precert Pro process insurance eligibility verification request?
This is a good question. If you think about what triggers a pre-cert, it actually is the eligibility verification. A lot of software systems are set up that if you can click, you receive eligibility results, but then if you need a pre-cert, well, then what? Well, that's a very easy thing for Precert Pro to process as well. So the answer is yes. And in many times when we put together a package to process eligibility for a client, if a pre-cert is required, we will include the eligibility in the cost of the pre-cert.
Mm-hmm. Okay, another interesting question. If you could address non-compete agreements, for example, how can I be assured they would not approach my clients directly?
Now that's a fantastic question.
Yeah.
Because I mentioned previously that Precert Pro has the ability to give a billing company an edge. And I also mentioned that we were formed from a billing company. Precert Pro, literally, honestly, we don't want to work with billing clients to a certain extent as opposed to a billing company. And when I say that, what I mean is that we're working with our billing companies. It's our focus to support your back office operations. The last thing we want to do is have a fear that we're going to look at encroaching on somebody else's business. So we will sign a non-compete. We sign a non-disclosure. It goes beyond just non-disclosure to the extent that employees are protected, relationships are protected, and we will not engage any other business except for Precert Pro. Because our opinion is that if your business grows, we grow with you, and we don't want to compromise that position.
Okay. Again, if you have your questions, go ahead and submit them. I have another question here, Grant. What happens if Precert Pro makes a mistake and we don't get paid?
That is a great question, and most billing companies understand this, even though they don't actively tell clients that they have it, but we carry insurance. So there is an insurance here that if we make a mistake, that Precert Pro is actually willing to reimburse the anticipated reimbursement of the procedure itself. Mm-hmm. We are so confident in our ability, and that's key. It doesn't make sense for a practice to come to us to process pre-certs if there's fear or risk that we're going to miss one. We have nailed this down to where if we make a mistake, we're going to pay for it. And if for some reason we don't have the ability, if it's expensive, again, I've mentioned $10,000 doses of drugs, we have insurance to back us up.
Right.
So again, the idea is that you don't have to worry financially. Precert Pro has measures in place to mitigate financial risk.
Excellent. Grant, thank you. I think that's all the questions we have for now. If you do have further questions afterwards, again, you're always welcome to reach out to us. Want to thank everybody again for joining us today and remind you that if you want this PowerPoint presentation, just send me an email at marketing@practiceadmin.com. And this has been recorded and it will be available on our website probably maybe by the end of this week. Grant, thank you for joining us today. Very interesting. And I've learned a lot about Precerts and what Precert Pro can do for folks. And I hope you have a great day. Everybody, thank you for joining us.
Thank you, Tamara.